It's been moved and supported. Any discussion on the correction and approval of the journal? Hearing none. And I believe our voting machines are still not working. So hearing none, all in favor say aye.
Aye.
Any opposed? Any abstentions?
Motion carries.
Thank you so much. Next item, please.
Report from the chair.
I just want to say that those of you who are on Zoom may notice that we are all wearing red today. This is Heart Month, and we do have a resolution acknowledging February as Heart Month. Unfortunately, heart disease is the leading cause of death for women throughout this country, and we want to also recognize that it's just a leading cause of death for all of us here in America, especially. So please do heart healthy activities this month and year round, which includes eating better, more fruits, more vegetables, and trying to move as much as possible, because it is called the silent disease, because people don't know that they have it and they can succumb to it. So that's all of my remarks for right now. Thank you. Next item.
Unfinished business, there is none listed. We are moving to offering of all petitions, ordinances, resolutions, and presentations. There are 4 resolutions listed on the addenda. Resolution number 1 is by Commissioners Anderson, Bell, and Haddis, supporting the proposed expansion of the Presbyterian Villages of Michigan location in the city of Westland to better serve residents and visiting family members and provide additional economic benefits to the community.
This is in Westland, Commissioner Anderson.
Thank you, Madam Chair. I just would,
Been moved and supported. Any discussion on this resolution? Hearing none, all in favor say aye. Aye. Any opposed? Anyone wish to abstain? Would you
Motion
like,
carries.
would like to open up the board for additional co-sponsors? Okay, again, we're doing the old-fashioned way. If you'd like to co-sponsor, please raise your hand and the clerk will note.
All commissioners will be noted as co-sponsors, all commissioners present.
Thank you so much. Next item, please.
On item number 2, a resolution by Commissioners Bell and Haddis strongly encouraging the newly merged Spectrum Beaumont Health System to establish open and transparent communications with Wayne County officials, the local communities in which they are located, and residents they serve throughout the transition, including but not limited to timely information regarding the closure of hospitals and outpatient locations and the reduction in beds at facilities in Wayne County.
Commissioner Haydos?
I think from the past practice, I feel the community have the right to know what's the future plan on some of the facility that service some of our communities in Wayne County. The communication in the past have a little bit of what you call difficulty to understand what they do, or the communication was not existent at all with the communities. So I think that give us the concern with this merger, and we urge them to be crystal clear and communicate with the community, especially with Wayne County, because largely they provide services in Wayne County. So with that, I just ask open it for all the board, the commissioner, or some unity. We all need to understand what's the future.
Thank you so much, Commissioner. Is there a support for the resolution?
Support.
It's moved and supported. The main thing, as Commissioner Hagan stated, is that there needs to be open and transparent communication between this new merger. A lot of times we have mergers, because they have shareholders to answer to, sometimes the quality of care can be questioned. So we want to make sure that as they proceed with this new merger, that they're communicating with Wayne County officials, what's going on, and making sure that the quality of care is continuing, moving forward. So it's been moved and supported. All in favor of this resolution, say aye.
Aye.
Any opposed? Okay, and Commissioner Hedges has asked to open up the co-sponsors. If you'd like to co-sponsor this resolution, please raise your hand.
Present will be noted as co-sponsors.
Thank you so much. Next item, please.
The item number 3, a resolution by Commissioner Bell acknowledging that the Wayne, Oakland, and Macomb County Commissioners hereby recognize the significant benefit of regional cooperation and join together to establish the Regional Partnership for Broadband Infrastructure and Equity and the Regional Partnership for Water Infrastructure.
Okay, so as you all know, November 12th of last year, we had the Tri-County Summit with Oakland and Macomb counties, was very successful. After that, we did a debriefing and decided that it would be worthwhile to continue the efforts of discussing how we can work collaboratively together and regionally together on infrastructure and all of those things, including broadband, roads, and water. So every county has already done a resolution similar to this resolution. And what we're going to do is establish in each county 2 members from our board to kind of get together regularly to discuss those issues so that we can get ready, one, for the Mackinac Policy Conference, to have something to present that we're doing something as commissioners on a regional basis, as well as planning for the next Tri-County Summit, which will probably be in the fall of this year. So this is a resolution just talking about our work in establishing this smaller committee of 2 members from each county to continue to work. Are there any questions? If not, I will move.
Yes.
I'm sorry, Commissioner Basham.
Yeah, what's SIMCOG's role in this?
SIMCOG, in this particular resolution, there is no role for SIMCOG.
Shouldn't they be involved in trying to more regional participation?
They were not involved with the Tri-County Summit, but we did reach out to them for some data. So we do reach out to them for some data, but this is primarily Oakland, Macomb, and Wayne County, and the commissioners of those 3 counties working together. But we are not excluding SIMCOG, but we're focusing on the commissions of those 3 bodies.
Support.
That was supported by Commissioner Marecki. Yes. I'm sorry, moved and supported. Any discussion further? Any further discussion? Okay, hearing none, all in favor say aye.
Aye.
Any opposed? And again, I will open this up to co-sponsors. If anyone would like to co-sponsor, please raise your hand.
All commissioners present will be noted as co-sponsors.
Thank you so much. Next item, please.
Item number 4 is a resolution by Commissioner Bell recognizing February as American Heart Month and encouraging all Wayne County residents to become better educated about the risk for heart disease and strokes, as well as further research scientific knowledge pertaining to cardiovascular health.
Okay, thank you, Madam.
And the chair, would you give me the honor to make this motion because my son just went under heart surgery. Thank God he came out.
Absolutely, Commissioner. Moved by Commissioner Hagan. I will support that motion. And again, we're all wearing red today. Friday was actually Go Red Day. Unfortunately, a lot of us were stuck in snow at home or somewhere else, but I think people still wore red to show solidarity, and we're all doing that today as well. So any discussion, Commissioner Daub?
Thank you, Madam Chair. I was on my drive in this morning. I was listening to the radio and can't remember what station I was listening to, but they were talking about Wear Red and Heart Health Month for women in particular, and how it's so important for women to know the signs of a heart attack because they are different than when men get them in the traditional, pain in the arm. And the symptoms for women are things like shortness of breath, breaking out in a sweat, pain in your shoulders. And it's it's general pain that women tend to feel pretty much most every day that you would discount as just, oh, this is just everyday pain for me. So that's why this month is so important in educating women to take care of yourself and go see a doctor regularly and, really pay attention to those symptoms. That's all I had to say. Thank you.
Yes, you're absolutely right. Our symptoms are different than men's symptoms, and we have to be aware of that as well. Thank you so much for that. So hopefully this recognition, today's resolution, will just make us more keenly aware of the look out for those signs and just think about our heart health, not only in February, but throughout the year. Any further discussion? All in favor, say aye.
Aye.
Any opposed?
Carries.
All right, and I will open it up for co-sponsors. Anyone who would like to co-sponsor, please raise your hand.
All commissioners present will be noted as co-sponsors.
Thank you so much. All right, thank you, Madam Clerk. Next item, please.
We're moving back to the agenda, page 2, reports from committees. We're on report A from the Committee on Economic Development. There are 3 items listed.
Thank you, Commissioner Jesus.
Thank you, Madam Chair. I move to receive and file item 1 and 2 and the approval of item 3.
Been moved and supported. Discussion. Commissioner Basham.
Yeah, thank you, Madam Chair. Item number 2. I'm wondering why they want to approve the geosystematic clay into the liner system at the hazardous waste landfill operated on I-94. That's the same landfill that we as a commission reduced from 80 millimeters to 60 millimeters. And are they having problems with that landfill? I mean, why do we need clay backup for the, to support the liner?
This came from the Michigan Department of Environment. More or less, they were informing us. That's why it's receive and file. I don't know if there was anyone from the Department of Michigan that was present at that meeting to ask those questions, but we can certainly reach out to someone at the state level to see what's going on that's wanting them to do this.
I'm very interested in that because when we, as a commission, reduce by 20 mils the liner, and then you get this, to receive and file, there's something going on somewhere. I, as a commissioner, would just like to know what it is.
I will have the clerk reach out to the Michigan Department of Environment so that they can give us a report, and hopefully maybe they can come to one of our meetings, especially since they're on Zoom. They don't have to travel down here. They can just come to our meeting.
No, they're
So
not on Zoom.
if we can put that, we can note that to have the Michigan Department of Environment come to speak to this, maybe at COPS meeting, perhaps, Public Services meeting, or even Health and Human Services, but we'll find a meeting where they can attend that. And also I'll ask them to provide a written statement that can go out to all commissioners. Commissioner Kenlock. I'm glad that you received that information, Commissioner. I have a question on item number 3. This is the subrecipient agreement with the City of Detroit and City of Hamtramck. Is there someone from Terry Carroll on the line? Mr. Carroll or someone to answer a question on this? Okay, Commissioner Jesus.
I'm on it. Here, excellent. Because of the COVID, there's some delay and they like to extend the time for it. Project, a little bit extra time for what, extra 1 year.
Extra year because of the COVID that delayed the project?
Exactly.
Okay. So now it's from July 2022 to June 2023. Okay. Thank you. Any additional questions on the Economic Development Report, Commissioner Scott? The question is, there's someone, again, I don't know if Terry Carroll doesn't appear to be on the line, but are these from the lawsuit, correct, Commissioner Scott? The lawsuit that they entered into because homes were taken back 40 years ago and they won the lawsuit. Are these those homes or are these new homes? I don't know if anyone on the administration can answer this question. Oh, thank you, Tony. So they're new homes? Okay. Put you on the spot, Tony.
Tony Guerrero from the prosecutor's office. I don't have direct information, but I had been one of the city of Hamtramck's attorneys in the past. My belief is that these two homes are part of the 40-year lawsuit that was going on, but I cannot verify that for you.
Thank you. Yeah, yeah.
I believe they are, and I think that this is merely because the cost of building materials went up so much that it doesn't appear that they're looking to increase the amount of money that was allocated. They're merely looking to extend the term for another year so they can get those houses built.
Gotcha. Okay, thank you. Absolutely, thank you. Any additional questions on the Economic Development Report? A roll call vote, please, Madam Clerk.
Commissioner Anderson? Yes. Commissioner Basham?
Yes.
Commissioner Clark Coleman?
Yes.
Commissioner Daub?
Yes.
Commissioner Hattis?
Yes.
Commissioner Killeen?
Right.
Commissioner Kinlock? Yes. Commissioner Knizik? Commissioner Morecki? Commissioner Baker McCormick? Yes. Commissioner Scott? Yes. Commissioner Varga? Yes. Vice Chair Palomero?
Yes.
Chair Bell?
Yes,
Motion carries.
thank you. Next item, please.
We're moving to report B from the Committee on Public Services. There are 7 items listed on pages 3 through 5 of the agenda.
Thank you. Commissioner Morecki?
Thank you, Madam Chair. I would like to move approval for items 1 through 7, and I'd like to highlight some of these when appropriate.
It's appropriate now. After we get support, is there support?
Support.
Okay, go ahead, Commissioner.
Okay. All right. If you look on your agenda, item number 1 is with the Spicer Group. This is to close out MDOT construction projects and DPS permit reviews. There's about 8 or 9 projects and about 25 permit reviews. And we discussed these, of course, some of these in our study meeting. Number 2 is Cadillac Asphalt and their subcontractors. It's $1.7 million for road improvements for less than a mile of Rotunda Drive between Commerce Drive into the I-94 freeway in Dearborn. 5 proposals were received in response to 309 direct solicitations. Number 3 is audio-visual equipment and supplies. These are for galvanized steel U-channel signposts. 3 proposals were received in response to 79 direct solicitations. And that is, they are the low bidder, comes out to a little less than $500,000. Number 4 is the Great Lakes Engineering Group. This is for engineering services to reconstruct the 6-mile road bridges over East Hines Drive in the Middle Rouge River in Northville Township. And this is one of our qualified supplier engineering groups. Number 5 and number 6 are both contracts, Act 51 funded, to supply snow blades and shoes for the DPS equipment division. This bid is going to be split into 3 different companies, but this is just for the approval of the first 2 companies. And we should be getting the 3rd company, I think, in tomorrow's agenda. And splitting it up into 3 companies like this will save the county about $125,000. And the last one, number 7, is Truck and Trailer Specialties for 28 dump uplifts. This is a sole source. Commissioner Basham, sole source company, and this is because the beds are configured differently than regular beds on trucks. They have a curved body inside, and this company can do that. And this is also Act 51 funded. So that's the end of the report.
Thank you so much, Commissioner. And I would remind everyone to please use your outside voice when speaking, because the people on Zoom cannot hear us. Commissioner Colleen, question?
Yeah, thank you, Madam Chair. On item 7 that the chair just went over, I read this as there was only one respondent that was, and they used the term as a sole bidder determined to be both responsive and responsible. Is that saying the same thing as that it's a sole source?
I don't know if someone's online that wants to answer that, but from my understanding at the committee, there were 236 direct solicitations, and this is the only company that can fit these beds.
Mr. Wagner is actually on the line. Aaron, you go ahead if you can hear us.
Yes, through the chair. Can everyone hear me?
Yes, sir.
Yes. This did go out to bid. We did only receive one bid, and that bid was determined to be responsible. So we are recommending that one bid that was received. So this is a sole bid, not a sole source contract.
Okay, because we were told in committee this was a sole source because of the bed configuration. So I don't know. Correct thing is here.
Any additional questions on the public services report? It's been moved and supported. Hearing no additional discussion. Roll call vote, please.
Commissioner Anderson, Commissioner Basham,
Yes.
Commissioner Clark-Holman,
Yes.
Commissioner Daub,
Yes.
Commissioner Hattis,
Yes.
Commissioner Colleen,
Aye.
Commissioner Kinlock, Commissioner Kenizik, Commissioner Marecki,
Yes.
Commissioner Baker McCormick,
Yes.
Commissioner Scott, Commissioner Varga,
Yes.
Vice Chair Palomero,
Yes.
Chair Bell,
Yes,
motion carries.
thank you. Next item, please.
We're moving to report C from the Committee on Ways and Means. There are 5 items listed on pages 5 and 6 of the agenda.
Commissioner Varga?
I would like to move 5 items for approval.
Speak a little bit more to your mic, please.
Oh, the mic's on, okay.
Mic is on.
Move the 5 items for approval that the committee recommended. Item 1 is moving money over to drain maintenance fund. Item number 2 is for the clerk's office to reallocate funds from one budget to actually one section of the budget to another department, sub-department. Item 3 is trying to read on the screen, Madam Chair. This also is for contractual services for the clerk. These monies were all allocated, is just being moved around for better purposes throughout the year. Number 4 is going to be repairing and replacing the Nankin Mill Bridge. And number 5 is moving some COVID dollars and some probate fund dollars for the operation of the behavioral health unit And it's in partnership with Wayne State University. The funds will be appropriated to contractual services and fringe benefits. Any questions, I would be glad to answer.
Thank you, Commissioner. Not a question, but a comment on number 5 with probate court. This work stems out of the work that this body voted on back in 2015 called the Stepping Up Initiative. That was the initiative to address those with either mental health issues or drug issues who are in our jails. This was diverting them into programs. For the last, 2 years, myself, Judge Burton, who's the chief probate judge, as well as Judge Kenny over our Third Circuit Court, and an array of other partners, including Wayne State, has been diligently working on what that looks like and what we can do as a county. We've gotten, of course, input from DWIN, input from the sheriff's office with the jail's office. I mean, we've been really working in partnership, and I'm so happy that we're now to the point where we're able to fund a behavioral health unit, because the issues that the people who go into the jail unnecessarily are because of behavioral health. And this is really going to address their core issues, so they're not ending up in our jails. Jails should be where criminals go and people who do violent criminal acts, not for people who are either having comorbidities with drugs and mental health. So this is a great step forward. So I'm thankful to Judge Burton, Judge Kenny, the county executive, the sheriff's office, Chief Dunlap, Wayne State, for working on this tirelessly and diligently for the last couple of years. As I've noted before, Miami-Dade County has a stellar program in the country for this, and we were able to go down and see their program, but it took them 20 years to get to this point where they're now the flagship on how to handle this population. So we've been doing a lot in just the 5 years that we've been working on it. So I'm just thankful that we're to this point. There's still more to go, but this is a great starting point to really see some improvements in the persons and making sure that we're taking care of the person and not just putting them in jail. So I want to thank everyone involved to get this on to our agenda for today. Questions? Terrence? Here, just talk loud, Terrence. Those mics aren't working back there. Perfect. Very good. And that's about the amount that we thought would be appropriate to get this unit underway. So thank you for that, Terrence. Commissioner Basham?
I can't help but tie this all together. There's a bigger picture, and definitely, this is a very positive thing that we're doing. But the fact that Wayne County, the largest county in the state of Michigan, Judge Kenny, it's hard for me to give him any praise. I've had a conversation with, they're only doing 2 trials a week for people that are actually, accused of being charged with things up to murder. How can we as a county not do better than that? We need to be a little bit innovative in some other things too, not just, let's make sure we support people that have mental health issues to keep them out of jail, but people that should be in jail, period. And that's not as happening as much as we should pay attention to.
You're absolutely right, Commissioner, and I'm sure Judge Kenny would love to come in and talk to us about that. So I'll ask him if you could do that. Commissioner Varga?
Thank you. Judge Kenny did talk about some of the reason why, and mostly it's because it's hard to find personnel to clerk the courtrooms because of COVID and also for the shortage. So there is a real problem, and he does realize that and is working as hard as he can to see what he can do to do better, and also to hire more people in the clerk's office so we can clerk. So there's a shortage everywhere, and personnel shortage, and that makes it very difficult for not only one judge, but all the judges, and for those that have to assign the cases. So it is, and they do acknowledge that there is an issue. Thank you.
Thank you, Commissioner. Commissioner Kenlock?
Just want to mention.
Thank you, Commissioner. And as you know, we're about 1,000 vacancies in Wayne County, and that's across the board, the clerks, the sheriff, even in the administration. So that's just an ongoing issue. And, you know, COVID has certainly exacerbated that. So as I stated before, if you're someone listening in and you are in need of employment, please consider Wayne County as we continue to
Recording
address
in progress.
salary issues as well. Commissioner Hayes?
To that point, Madam the Chair, I know there are some other governmental agency
To the mic, please.
or private business suffering from the same situation. And I think it's time for Wayne County to hire consultant to see where we at on the pay scale compared to other county who's not losing people to do the job in the court and the administration all over the county and the sheriff department. I think we need to evaluate where we at instead of keep dealing with it from day to day, and the damage would be larger and larger scale as we wait. So my recommendation is we need to look into it and hire consultant to tell us where we at, how can we fix this problem.
Absolutely. And I don't know if Khalil is on the line because we've had that discussion recently. Khalil, are you on the line by any chance?
Madam
Or-
Chair, Andrew
go ahead.
Candrivas, I
Go
don't,
ahead, Andrew. Hello.
hi, good morning. Good morning, everyone. Khalil is not on the line. I believe our new personnel HR director, Donna Wilson, did hear the concerns of the commission, and I'm sure that she'll be addressing you all shortly about that issue. I do know that there have been ongoing studies and discussions way before the current great, what do they call this? The great, whatever.
Great resignation.
Great resignation. There we
Yeah.
go. Before the great resignation. I will just point out, sorry to take up your time, but real quick, I will point out though, if you caught, I'm sure you were all watching a lot of the news coverage of the snowstorm coming in. And you know, we've struggled to hire drivers for our DPS crews. But you know, if you did catch it, other counties around here have been struggling as much as we are for that one position. And I suspect that all of our positions are equally difficult to fill, whether you're in Macomb, Oakland, Wayne, or Monroe counties. But I will discuss this with Janelle Allen, COO, and our new Director of Personnel Human Resources, and we can get something to you guys shortly.
Thank you, Andy. Do you want to finish your point, Commissioner? I don't think he heard you. Did you hear him, Andy? You're on mute, Andy.
Yeah, I'm sorry that his mic was not, whoever was trying to speak, their mic did not come through.
I think it's not because you're connected to that, and so I'll restate it, Claire. I don't think they can hear anybody on that last row. He was just saying that last year we talked about the study, and was that study completed or not, was the question.
Yeah, I'm sorry. There have been so many different studies by job function ever since Tony Saunders was here and on to today. So I can't really comment on which study has been completed, and I want to make sure we're all talking apples to apples here.
And we'll talk afterwards, Andy, about that study. Is that okay, Commissioner? Thank you, Commissioner Varga.
Thank you. What Commissioner is talking about when we raised the wages for the minimum wage of $15, those that were currently making $15 prior to the bottom tier coming up, they were going to look at adjusting all of the other salaries beyond that, because then now it's not fair for people who were making 15 to still make 15. So they were going to look at the adjustments to all of those that would be pushed up. And also we have to remember that many of these negotiations have to be done with the unions when it comes to looking at personnel services. And they were also going to look at, this is coming from our Ways and Means deliberations from the last budget, that they are going to see how they might be able to work with the unions to coordinate or push together several different classifications in order to better serve the county and our employees. So all of that is going to take time, and I think, Andy, that's what Commissioner was asking about, Commissioner Kinlock, if that study had been done.
Thank you, Commissioner.
Thank
And
you.
again, I think we need to just make sure that we do have something to look at all other wages in the county. We started that a few years ago, many years ago. The conversation started. I don't think the study ever started, but the conversation has started many years ago, and we need to really just get that done. So thank you. All right, any further discussion on the Ways and Means report? It was moved by Commissioner Vargas. Is there support? Okay, moved and supported. Roll call vote, please.
Commissioner Anderson? Yes. Commissioner Basham?
Yes.
Commissioner Clark Coleman?
Yes.
Commissioner Daub?
Yes.
Commissioner Hattis?
Yes.
Commissioner Colleen?
Aye.
Commissioner Kinlock? Yes. Commissioner Kenizik? Yes. Commissioner Morecki?
Yes.
Commissioner Baker McCormick?
Yes.
Commissioner Scott? Yes. Commissioner Varga?
Yes.
Vice Chair Palomero?
Yes.
Chair Bell?
Yes.
Motion carries.
All right, thank you so much. Next item, please.
We're moving to report D from the Committee on Health and Human Services. There are 5 items listed.
Commissioner Baker McCormick.
Thank you, Madam Chair. I move items 2 through 5 and move to receive and file item number 1. And I'll just go through each item. Item number 1 is the Health and Human Services Department of the state, local stabilization funding. This is approximately $700,000 in funds to support inspections for food inspections, HIV programs, hearing and vision programs. Any questions or?
Support.
The next item is.
I'm sorry, Commissioner Kinlock, did you have a question on that one, or you? Okay, you can go complete the whole report, then we'll have questions afterwards.
Okay. The next item is item number 2. And this is for housing, home visitations for the Healthy Families American Program. And this provides free, no-cost diapers, formula, prepaid, groceries, phone cards for at-home or families at risk. Item number 3, this is a grant agreement between Wayne County and the state of Michigan for water quality testing. This is for drinking water as well as campgrounds, facilities, and public pools. And also non-community water areas. Item number 4 is a 2-year, 1-year option to renew contract between Wayne County and DWIN, which they are the third party involved in this is Assured Family Services to provide at-risk juvenile mental health services. This will service about 4,300 youth with mental health issues. And item number 5. This is another, and actually this is a retroactive contract between Wayne County and DWIN, and also WellPath. This is I believe this is the final payment for the jail mental health services for WellPath. Report.
It's moved. Do we get support? Okay, moved and supported. Discussion? Commissioner Basham?
You might have guessed I'm going to talk about the retroactive contracts. It's all about process. It's not about the item itself. But people need to understand that if you're having, back and forth discussions, you need to start earlier, or, you can, there's a process to move the item forward. I'm trying to reduce the amount of retroactive sole source contracts. So I'll always, as long as I'm on the commission, if you see retroactive sole source, I'm going to be raising that question. So I will reluctantly support this item. But the point is that we need to, as a commission and as staff, realize that, if we want to bid an item out and get an item back, then we need to improve the process. I'll just leave it at that.
Thank you. Commissioner Kinlock.
Recording.
And folks are like, just quick update, waiting on 2 wing walkers. We're not reaching.
Point of order, Madam Chair. Point of order.
Yep, Commissioner
That
Basham.
that has nothing to do with either one of these items, and I'd be glad to speak to it when we talk about audit. Thank you.
Okay, thank you.
And
Okay, well, I was sorting it up. Okay, but
You're fine.
okay.
Okay, you're
Well,
fine.
just-
So the questions were,
My next
oh, go ahead.
question is, to the council, to our commission.
So through the chair, Commissioner.
Thank you. Yes, Commissioner Baker McCormick.
So I just wanted to let the commissioner know that we will be discussing the medical examiner's office tomorrow. So if you would like to attend the meeting, you will hear a update of what's going on and the status of the issues that occurred several months ago.
Thank you, Commissioner.
Tomorrow at 1:30 is the Health and Human Services meeting. So they will be there.
Thank you. And I did also see Director Jordan's hand up. I don't know if she still wanted to speak. Director Jordan on Zoom.
Good morning. My name is Melita Jordan, the Director for the Department of Health, Human and Veteran Services. I just wanted to address Commissioner Basham's comment and just simply say to you that I appreciate your comment, and I've heard it since I've been here, of your concerns around retroactive contracts. And I certainly support and agree with you. I have met with Mr. Eric Doa. This particular contract, is my understanding, for many years have been late and or retroactive when it gets to the commission. I am addressing that not only with my own staff in terms of what you just said, starting earlier with project timelines to be able to make sure that we can get these contracts addressed and to the commission at an appropriate time. So I appreciate your comment, and certainly I'm working on that. And we'll continue to make sure that we can get things to you in the appropriate manner and within the time frame that it is allocated to be voted upon. Thank you.
Thank you, Director Jordan. Any other questions on the Health and Human Services report? Hearing none, roll call vote, please.
Commissioner Anderson,
Yes.
Commissioner Basham,
Yes.
Commissioner Clark Coleman,
Yes.
Commissioner Daub,
Yes.
Commissioner Hattis,
Yes.
Commissioner Kleen,
Aye.
Commissioner Kinlock,
Yes.
Commissioner Knizik,
Yes.
Commissioner Varga, Vice Chair Palomero,
Yes.
Chair Bell.
Yes.
Motion carries, and have Commissioner Knizik as an abstention on item number 2.
Thank you. Commissioner Knizik, can you touch your microphone to see if it's on? Just tap it.
Yeah.
Tap it. Okay, thank you. Because speaking to it, getting comments that they can't hear you. Okay, thank you. All right, very good. Next item, please.
On report E from the Committee on Audit, there is one item listed.
Commissioner Basham.
Well, thank you, Madam Chair. This item is the 2022 officers, our annual audit plan. In its comprehensive report that details the audits, reviews of the upcoming year. The plan is transmitted based on our internal assessment of potential risk for the county across the executive branch departments and offices managed by elected officials and well as component units and agencies in the county. The Office of Auditor General received input from across the county, and that input was considered in development of this plan. The plan is subject to change based on risk requests from the commission. And one of those things is actually the medical examiner's office. And one of my fellow commissioners had asked a question about Karen Drew in the medical examiner's office. The Auditor General and her staff are working on that. They're doing a comprehensive report. The report is not complete yet. It takes, actually it'll be a number, probably 4 or 5 more weeks before we have a report from the Auditor General and her staff relative to the medical examiner's office. So we will be getting a comprehensive report from the medical examiner's office soon. I call about that about once every week or so. And just one other note that I don't know if you noticed, this is not Marcy Cora. She is recovering from COVID. And today is her birthday, so I'd like to be one of the first to wish her a happy birthday, even though she's home and recovering and she's on Zoom. Thank you.
Thank you. Thank you, Commissioner, and happy birthday, Marcy, on Zoom. Sorry you're recovering from COVID. Thank you, Commissioner Basham, for your report. This is one item to receive and file. We have a motion by Commissioner Basham.
Yes.
Is support. It was Commissioner Killeen supported?
Sure.
I thought that was you. Okay. Moved and supported. Committee on Audit, receive and file. All in favor, say aye.
Aye.
Any opposed? Ayes have it. Before we go on, I see Mr. Carroll is here. There was a question, Mr. Carroll, under the Economic Development Report from Commissioner Scott. Go ahead, Commissioner Scott, if you could repeat your question to Mr. Director Carroll.
Terry Carroll, Community Development Director. You're very perceptive. These are in the Grand Haven Dyer subdivision, the lawsuit subdivision. They've asked for an extension. For right now, these are the last ones, but that's not to say because HUD is going to, we just received word about 3 or 4 weeks ago, HUD is going to be putting some more of our unspent NSP money and our program income money back on our line of credit. So you might see another house or two come through depending on how that selection process goes. Hopefully we can get another house or two out of it. Yes. The Grand Haven Dyer subdivision.
Thank you, Mr. Carroll. That was a question that came up under the Economic Development Report. Thank you so much. Going back to the agenda, next item, Madam Clerk.
You're on Report F from the Committee on Public Safety, Judiciary, and Homeland Security. There are 4 items listed on pages 8 and 9 of the agenda.
Thank you so much, Commissioner Clark-Holman.
Thank you, Madam Chair. I'd like to move approval of items 1 through 4.
It was moved and supported by Commissioner Scott.
And a quick summary of the items. Item number 1 is a interlocal funding agreement between Macomb County and Wayne County. It's for grants under the Homeland. It's a Homeland Security grant. The next one, where Macomb County is the designated fiduciary. Item number 2 is a U.S. Marshals Service agreement in the amount of about $10,000 to coordinate a permanent regional fugitive task force. And item number 3 is a MOU, a memorandum of understanding between Wayne County and the AG's office for $148,700 to augment the sexual assault kit task force, which will allow for 1 crime analyst and 1 clerical. in the prosecutor's office. Item number 4 is, this was an exigent approval by the chair. And it was a $500,000 grant with no matching funds from the county for the money going to the Detroit Police Department for its shot spotter technology. And the county is acting as the fiduciary. So that's it.
All right, very good. Thank you. It's been moved and supported. Any discussion on any of the items? Just a quick question about the fugitive task force. Is that something that our sheriff's office will be working with, or is that the Michigan State Police?
Which item are you talking about? Item
Number two,
4?
number 2, the marshal service.
Number 2.
So they'll be working in conjunction with our local law enforcement?
I think so, but if there's someone here that can speak on this.
Through the chair, this is Sumaya Harp. Can everybody hear me?
Yes.
Okay, perfect. This is a task force between the U.S. Marshals, City Westland, City Detroit, Sheriff's Office. Yes, there's a few communities that do this fugitive fugitive enforcement. They track fugitives and they send them to jail.
Okay, I just want to know if it was a part of a collaborative effort that it is with the sheriff, the Detroit Police. And
Yes, the sheriff's office is very involved. Yes, the sheriff's office is very involved.
Thank you.
Thank you.
Any additional questions on the items in the public safety report? Commissioner Dahl?
Thank you, Madam Chair. Is there someone on the line who can give us a short explanation of what the shot spotter technology is?
That's item number 4.
For item number 4, thank you.
Samaya, are you on the line for item number 4?
Through the chair, this is not a sheriff's office item. I don't have any information on it.
So I am aware of a little bit of this, Commissioner, and what it is when shots are fired anywhere in the city of Detroit, there's technology that can pinpoint what area those shots were fired to help law enforcement track down a shooting event. That
is correct.
The long and short of it. The layman's explanation for it. But yeah, and it's a technology that I think the Detroit Police Department just recently, over the last couple of years, invested in. And the county has served as a fiduciary for the funds that they received from the, looks like the Department of Justice.
And it just increases the total amount from 2.4 to 2.9.
Yeah, which is good. So the effort is to assist the police when there's a shooting event to find out where those shots occurred.
Thank you, Madam Chair.
Any additional questions on the public safety report? Commissioner Anderson?
Thank you, Madam Chair. I just wanted to additional funds.
Certainly. Good morning again, Tony Guerrero, Chief of Legislation, Grants and Community Relations for the Prosecutor's Office. These additional funds allow us to hire a crime analyst and a clerical employee. All of the rape kits have been tested, all over 11,000, but now we're still in the process of analyzing those kits to determine if there's DNA to allow us to actually locate the perpetrator. We found that by going through those kits, believe it or not, 39 states have been touched by these serial offenders. This is just an ongoing portion where the AG's office is working together with us to provide the crime analyst and the clerical support. It's just part of the ongoing program. We do have stats that we put out every month. I shouldn't say we, they're kind enough to share them with me. But the statistics are put out every month by the sexual assault kit team to let everyone in the county, specifically the commission, to know exactly what we have done in that particular month and what we've done cumulatively throughout the year. I hope that helps to answer your question, Commissioner. Oh, no, certainly. I'll make a note. I'll be happy to have them sent to you today or tomorrow. Your point is well taken, sir. Legislation was passed by the Michigan legislature to require the tracking of the kits. So the short answer to your question is absolutely. What transpires now is the police agency has a very limited amount of time to submit the kit to the laboratory. And Prosecutor Worthy has been at the forefront. We are now basically a national model here in Wayne County for how these are to be tracked throughout the country. And believe it or not, the Detroit Police Department was not the only one that had these kits put off in what I'm going to call limbo. But quite frankly, there are other departments across the country that are suffering the same consequences. And all I can tell you is the answer, yes, based upon the statute and the timelines that are in place. There's even a portal so that the victim, while they can't look at the results and so on and so forth, they can tell exactly where their particular rape kit is in the process. So it tracks them perfectly. And I'll use Kim Worthy's words. You know, if we can track a package from Amazon, why the heck can't we track a rape kit all the way through the system? I hope that answered it, but I believe that with the legislation and the timelines that are in place, I don't think we're going to see any more of these sexual assault kits going by the wayside. The Prosecutor Worthy leaves no grant unturned. She goes after every dime that she can get. This is extremely important work. Thank you.
Thank you so much. Commissioner Kalian, the Commissioner Clark Coleman.
Mr. Guerrero, before I want to put a finer point. You alluded to it, but departments all across this country are behind on their rape kits, and the numbers are kind of staggering, correct? So, you know, I'm glad we're tackling it. You mentioned that these individuals are multi-state as well. And so being behind on the kits doesn't allow police departments to share information with each other. Like, hey, we got, you know, somebody that turned up in your area. So nationwide, how bad is it, Mr. Guerrero?
I can't tell you how bad it is nationwide, but I can say to you that the process that was developed here has been adapted in other jurisdictions based upon what's been done with the sexual assault kits so far. Prosecutor Worthy's been able to identify over 800 serial rapists touching 39 different states. But to answer your question as to how big of a problem is it nationwide, I couldn't give you the direct answer, but I do know that it's a lot larger of a problem than was ever anticipated.
Yeah, and I think the fact that other places are adopting what the prosecutor here is doing is also testimony in terms of how far behind so many other jurisdictions are.
Absolutely.
Thank you, Mr. Guerrero. Thank you, Madam Chair.
Thank you. Commissioner Clark Coleman?
Yes, I just wanted to touch on, again, the importance of the victims. There being technology for the victims themselves to track it. That way, you know, even if one of the departments drop the ball or don't, the victim, that's the one who needs to know where that test kit is. So the fact that the victim is able to track it and find out what the status of that is, then there's less likely a chance that this would ever happen again. And certainly it's less likely a chance that the individuals who are involved in this whole process would ever let that happen, because the victim's not going to let it happen.
Absolutely. Thank you for this great conversation, because last summer, I think I made mention that during the National Association of Counties Conference, this issue was on the forefront during, I think it was our public safety or a large urban county, I think it was large urban county caucus, the Luck Caucus, where the director for Joyful Heart came to the conference. Joyful Heart is the foundation that Marissa Harder-Tate founded to help victims. And that issue became a part of our conference last year. And I mentioned this because, one, to Commissioner Colleen's point, it is happening across the country, Miami, Memphis, many counties throughout the country. And two, they made sure to mention at the national conference last year that Wayne County is on the forefront of this issue, and Wayne County is the model of how to handle this certain situation with rape kits nationally. So I was very pleased to make a couple of comments, and the commissioner over the large urban county caucus was very excited that the work that we're doing and the fact that they can duplicate it in other jurisdictions across the country. So yes, it's an issue, not just here, but elsewhere, but we are the lead in how to fix it nationally. So thank you for that. Any additional questions or comments on the public safety report? I think we had a motion and support. Roll call vote, please.
Commissioner Anderson?
Yes.
Commissioner Basham?
Yes.
Commissioner Clark Coleman?
Yes.
Commissioner Dobb?
Yes.
Commissioner Hattis?
Yes.
Commissioner Colleen?
Aye.
Commissioner Kinlock?
Yes.
Commissioner Kenizik?
Yes.
Commissioner Morecki? Commissioner Baker McCormick?
Yes.
Commissioner Scott? Commissioner Varga?
Yes.
Vice Chair Palomero?
Yes.
Chair Bell?
Yes,
Motion carries.
thank you. Next item, please.
We're moving to report G from the Committee on Government Operations. There are 7 items listed on pages 10 and 11 of the agenda.
Commissioner Dobb?
Thank you, Madam Chair. I'd like to move items 1 through 3 for receive and file, and items 4 through 7 for approval.
Support.
Okay, and then I just want to go through the items briefly. Item number 1 is a report from the Human Relations Business Inclusion Division, just regarding their current activities. And item number 2 is a report from Corporation Counsel, our settlement report for September through December. And there were 3 settlements totaling $190 $1,000. Item number 3 is a report from the Indigent Defense Services Department. Item 4, we've got a grant agreement with the State of Michigan Department of Licensing and Regulatory Affairs, and that was for our monumentation and remonumentation for the survey corners, and we get that every year. Item number 5 is an ordinance to amend Chapter 130, Section 130-7 of Wayne County Code of Ordinances. Got that out. And that is to increase, it's for hazard pay for jurors, and specifically changes the end date of that to be the end of the COVID-19 pandemic. Item number 6, we've got a modification of a 2-year legal services contract with 1-year option to renew with Dickinson Wright. And item number 7 is an approval of an amendment on number 7 to professional services contract with Gawker Point Communications.
Been moved. Is there support? Do we have a motion?
Support.
Okay, we're going to move 1, 2, 3, 4, 6, and 7. We'll carve out number 5, which is a public hearing. So motions to 1, 2, 3, 4, 6, and 7, moved by Commissioner Dobbs, supported by Commissioner Hayes. Okay. Any discussion on those items before we move to the public hearing? Any discussion on those items? 1, 2, 3, 4, 6, and 7. Okay, roll call vote on those items. And then we'll do the public hearing.
Commissioner Anderson,
Yes.
Commissioner Basham,
Yes.
Clerk Coleman,
Yes.
Commissioner Dobb,
Yes.
Commissioner Hattis,
Yes.
Commissioner Colleen,
Aye.
Commissioner Kinlock,
Yes.
Commissioner Kenizik, Commissioner Morecki, Commissioner Baker McCormick,
Yes.
Commissioner Scott, Commissioner Varga, Vice Chair Palomero.
Yes.
Chair Bell,
Yes.
motion carries.
Okay, thank you.
I'd move to open a public hearing for item number 5.
Support.
It's been moved and support to open up the public hearing for item number 5, and that's the authorization of pay, hazard pay for jurors. Do we need a roll call vote for, we do a voice vote. Okay, the public hearing is open for item number 5. It's been moved and supported. All in favor, say aye.
Aye.
Any opposed?
Motion carries.
Hearing, is there any public comments on the hazard pay for jurors? Clerk? Are the courts on the line? Anyone from Third Circuit Court on the line to discuss the hazard pay for jurors?
Yes, Madam Chair. Lynn Roberts.
Go ahead.
Hi, good morning, Madam Chair and Commissioners. Lynn Roberts, Chief Financial Officer for the Third Circuit Court. The court is coming to this honorable body to recommend or request an extension of the juror hazard pay that was adopted at the onset of the pandemic. The attempt is to offer an additional $10 per day that was previously covered under CARES funds that were awarded from the federal government. And the use of CARES funds expired as of December 31st of 2021. And as we move forward, we are still in the midst of the pandemic and would like to continue to offer this to the jurors. Since CARES funds are no longer available, the primary source of funding this will come from the court's current appropriation to pay juror expenses, since we are still not commencing jury trials at our full capacity. And so we are requesting to extend this this ordinance until the CDC declares that the country is no longer in a pandemic.
Thank you, Ms. Roberts. Any questions? Commissioner Marecki, I see your hand.
Thank you, Madam Chair. Morning, Lynn. When are jury trials going to start, and when are judges going back to, you might have said that, but I have a hard time hearing in here.
Oh, not a problem. Through the chair, jury trials are actually commencing now. The challenge is that we are not at full capacity for a couple reasons. There were some discussions earlier on another agenda item. There is a clerk shortage in the county clerk that prohibits us. So if we were to open up all of the jury trial, all of the courtrooms to proceed with jury trials, we still would not be in a position to, because we don't have all of the clerks that we need, as well as we don't have all the sheriffs that we need to man every single courtroom. The other consideration is also we want to still accommodate some level of social distancing for the jurors. And so we are having discussions currently to do what we need to do to increase the level, the number of jury trials that we're able to commence. But the judges are still actively, if there are jury trials, those are being made, we are open, the court is open, and we have been open to accommodate those hearings. We just are not at current full capacity.
Okay, thank you.
Additional questions for Ms. Roberts? Additional questions on this item? Counsel Johnson?
Just one comment.
Thank you, counsel. This would be backdated to January 1, 2022. Okay. Additional comments on this item? Okay, is there a motion to close public hearing?
Move to close the public hearing.
Support.
Moved and support to close public hearing. All in favor, say aye.
Aye.
Opposed? Okay, now we need a motion to approve item 5.
Madam Chair, I'd like to move to approve item number 5.
The support to approve item number 5. All in favor, say aye.
Aye.
Any opposed?
Motion,
Ayes have it.
motion carries.
Thank you. All right, thank you. Next item, please.
We're moving to report H from the Committee on Seniors, Citizens, and Veterans Affairs. There's one item listed.
Commissioner Scott.
Support.
Been moved and supported. Any discussion on this item? And as stated by Commissioner Scott, this is for the 34 communities in Western Wayne for their senior meals.
Supported the item?
Who supported Commissioner Dobb? Okay. Any discussion on this item? Any further discussion? Okay. Oh, Commissioner Dobb.
Thank you, Madam Chair. Is there someone from the Senior Alliance or I guess from Wayne County Department of Seniors Services who can give us an update on, I know that we've been looking for volunteers to help with the Meals on Wheels program. Is there enough drivers? Do we have enough drivers? Are people able to get their meals on time?
Is Ms. Litton?
Through the chair, Commissioner Bell Jones of Rockets, Division Director, Wayne County Senior Services, to address Commissioner Dobbs' question. Currently, we are providing meals in a frozen state. We are still delivering frozen meals on Mondays and Thursdays to our homebound clients. And for the most part, we are doing pretty well with volunteers. There are a few communities that we could use some assistance. Mostly in the Inkster, Wayne, and Westland area, if that answers your question.
Okay, thank you.
Mr. Scott just mentioned that Inkster was also in need of additional volunteers.
That is correct, Chairman.
Very good. Thank you, Joan. Commissioner Marecki.
Thank you, Madam Chair. And I'm really having a hard time hearing, so I don't know if Joan talked about congregate meals. Are we doing any of those?
Through the chair,
But
we are providing congregate pickup meals. Clients are able to come to the site and pick up meals to go for congregate.
Oh, okay. So they're still picking it up. You're not serving it. Okay, thank you.
Yes.
Additional discussion on Senior Citizens and Veteran Affairs Committee. Hearing none, all in favor say aye.
Aye.
Any opposed? Ayes have it.
Carries.
Thank you. All right, next item, please.
Here on page 12 of the agenda, upcoming committee meetings.
Okay, please note the committee meetings for this week. If you have any changes, please let our clerk know. Next item.
Here on new business, there is one item listed on the agenda and two on the addenda. Item number 1 is requesting commission approval of the reappointments of James Perry and Margot Lane Martin to the Substance Use Disorder Oversight Policy Board.
Move approval.
Been moved and supported. Commissioner Kleen.
Thank you, Madam Chair. Just for a little history on this, when the legislature, 7, 8 years ago now, got rid of the mental health agency in Wayne County and created the freestanding mental health authority, to win as we know it today, integrated health. But back when it was an agency, substance use disorders was dealt with differently. It wasn't part of the mental health agency. And so when the law was changed, they folded in substance use disorder into what is now the Detroit Wayne Integrated Health Network, and created this board, Substance Use Oversight Board, which has about a budget of about $5 million. The substance use community, as you know, Madam Chair, were very nervous about being folded in to the Integrated Health Network after operating kind of independently for so long. I think that's gone well. But this is what this board is for, is to oversee substance use disorder, make recommendations, and like I say, they have about $5 million annually in state funding that they control and spend on substance use disorder issues around the county. Thank you, Madam Chair.
Thank you. Thank you for that history on this. And the two persons, Mr. Perry and Ms. Martin, are reappointments, so they previously served. And I don't know if they're on Zoom or not. If they are, they can unmute themselves and just introduce themselves again. If not, again, this is a reappointment for those two positions. Don't see them. Okay. And if it's okay, we have 3 items under new business. Is it okay we take them all together? That was item number 1. Item number 2 under new business, Madam Clerk.
Item number 2 is requesting commission approval of a cooperative agreement between the Charter County of Wayne and Brogan and Partners Advertising Consultancy through My Deal to develop and execute a comprehensive advertising and marketing public education campaign focused on the importance of COVID-19 vaccines and testing in Wayne County.
Okay, who is to speak to this on the administration side? Andy?
Madam Chair, I know that our director, Jordan, was on. And I don't know if she's been experiencing any difficulties here. I'm looking for her right now.
Hello, this is Jennifer Floyd. I'm the acting health officer for the health department. Director Jordan is trying to get on, so she said if you could just give her a moment, she'll be right back. She's trying to get back on. She got kicked off of Zoom.
Okay, while she's doing that, let's go to item number 3.
Item number 3 is requesting commission approval of a cooperative agreement between the Charter County of Wayne and Whole New Management Group through My Deal to provide COVID-19 vaccine and testing services at 5 new clinics in Wayne County.
This is also, I think, a Director Jordan contract as well.
Correct.
So we'll wait a
We
moment.
should be on in a second here, Madam Chair.
Okay, again, this is Jennifer Floyd, Acting Health Officer for Wayne County Public Health. She's still having some challenges, so I can go ahead and speak to those particular contracts if that's okay.
Go ahead, ma'am.
So do you want to go back to Brogan, or you want me to talk about Hanu? I don't know what order.
Start with Wayne and Brockton, please.
Okay.
Advertising.
Okay, so this is a contract to provide a marketing campaign to publicize our 5 new upcoming hybrid sites. And when I say hybrid, I'm referring to vaccinating and testing being done in the same site at the same site. So that is what the Brogan contract is for. The next item on the agenda is for the contractor who actually be performing the testing and vaccinating at those respective sites.
Okay, so the first item, number 2, is advertising, $1.7 million for advertising the 5 sites. What type of advertising will we be doing? And how long will the advertising be going on? You can start with those 2, and I'm sure there'll be questions from commissioners.
Okay, so that advertising will consist of billboards, gas station ads, there will be some commercials and some radio. And
Television
also
commercials?
and some online publicizing.
I'm sorry, you said television commercials or online commercials?
Television commercials and online publicizing as well, including social media.
And how long will this go?
These sites are slated to end at the end of last day of March, which is when the funding ends, and the advertising will continue throughout this entire performance period.
Questions from commissioners on this item, item number 2, the advertising for COVID? Commissioner Baker McCormick.
Thank you, Madam Chair. So this is advertising basically for about a month and a half. Is that correct?
Just a little under 2 months, correct.
Okay. And I noticed that we had a contract with them to do kind of the same thing previously. Is that correct?
That is correct.
Okay. And this contract is $700,000 more. Is there a reason when it's basically the same thing? And I think the time span on the other contract, which was $1 million, was a longer time span for advertising. So it just seems like this is a lot for a little over a month and a half.
So this particular campaign includes a television as well as a lot more radio. So some of the services included in this campaign are a lot more costly than in the previous campaign. So that is one of the reasons for the additional cost. And when I say additional, I mean the cost is more than the last time we did a campaign.
Right, right. Okay, and then there's the community outreach. What did that look like before? I know it says that you're going to reach out to Black community leaders and sororities and fraternities. What does that look like? What does that mean exactly?
So one of the particular subcontractors under Brogan also is active in the community with respects to canvassing. So they know that community, they know how to reach out to that community. And so that is part of the reason we'll be reaching out to these sites, as well as the fact that we wanted to focus on the municipalities that are reoccurring in the top 10 list pretty much every week. As far as new COVID-19 cases. So that's also a reason these particular sites were chosen, and those particular communities are also showing up when we perform our data reports. For a lot of you in this group, those particular groups are showing to have a higher case counts.
Okay, so when they're reaching out to these organizations and groups, I'm just trying to figure out what that means exactly.
Are they just, I'm not sure what that means.
Okay, so another part, and I see Director Jordan's hand up, I just want to say one more thing. Reaching out to these communities, including some of those efforts like focus groups, to find out what is the best way to reach these respective communities. And I see Director Jordan's hand is up, so Commissioner Bell, I don't know if I can throw it to her, what the rules are. how this
Yes,
works.
that's fine. Director Jordan?
This is Melita Jordan, Director of the Department of Health, Human and Veteran Services. Thank you for allowing me to speak. I got kicked off of the system, so I'm on my phone. So in order to, in terms of answering your question, Commissioner Baker, again, the idea is to make sure that, again, we are able to.
Very hard to hear you.
Sorry. Can you hear me a little bit
Yes,
better now?
Much better, thank you.
Thank you. We are reached out to Brogan to assist us, of course, in terms of doing an expansive campaign and also reaching out to a number of our leadership as well to help us address the communities within those areas that we are focusing on. And so hopefully that we will be able to work with the commissioners as well as with other leadership to reach into the community. Most recently spoke with Commissioner Baydoun in his community and addressed the town hall. And so we're trying to make sure that we can really get the message out so that we can increase the vaccination rates as well as the booster rates within these communities. And so I also want to add that although you spoke about the price, I also want to say, because we were looking to perhaps start sooner than where we are at this point, but we're not. And so I do suspect that the price will be less than what is currently here. It says do not exceed. We're not going to exceed that amount. We expect actually to decrease the amount.
Great, great. So I belong to a sorority, and that's one of the questions that I wanted to clarify, because maybe what you're doing or what information you're providing, we can take back to our organizations or help in some way.
Absolutely. And I would welcome that to work with us in terms of not only reaching the sororities and the fraternities and the other Pan-Hellenic organizations in the various ethnic organizations, because again, we recognize that there has been still a low uptake in certain age groups and certain race and ethnicities. And so we need all of the support we can still get to make sure that we are reaching the communities where we see the high numbers. We also are addressing the number of new refugees who also have arrived here in Wayne County to make sure that we have ambassadors to help us in the community to reach them as well, to get them vaccinated. And we're reaching out to parents so that we can certainly reach our 5-year-old, the 12-year-olds, in addition to the 20 to 29-year group is also one of our lowest groups in terms of getting vaccinated. So it is going to be a very upbeat as well as expansive outreach with billboards, as Jennifer have already mentioned, gas stations, in addition to the radio, banners, and so forth, social media, all the venues that we know that we can actually reach individuals.
Thank you.
Thank you so much, Commissioner Anderson and Commissioner Marecki. Oh, she has to, oh, I'm sorry. I'm sorry, Commissioner. Because your mics aren't connected to Zoom, they can't hear you when you speak. So I'll repeat it. What did you say? I'm sorry. Oh, the sites, okay. Okay, the question, Dr. Director Jordan, is you can provide a list of legitimate county-sponsored testing sites so that the public can know the accurate places to go and that they're not going to places that aren't working properly with the testing and the vaccination sites. If you can
Sure.
list those.
Sure. The hybrid sites will be Dearborn Heights at Berwyn Senior Citizen Center at 26155 Richardson Street in Dearborn Heights. In Livonia, the Livonia Senior Center, 15218 Farmington Road in Livonia. Redford at the Redford Township Community Center, 12121 Hemingway in Redford. Taylor in Wayne County Community College District in Downriver Campus at 21,000 North Line Road. And in Westland, Jefferson Barnes Community Vitality Center, 32150 Dorsey Street in Westland. And these vaccination sites will be what we call a hybrid. So it will be vaccinations as well as testing. We will be doing PCR testing, and also we will be doing the rapid testing.
Thank you. Follow up, Commissioner Anderson? In writing, absolutely. Yes, if you can provide that in writing, Director Jordan, that'd be helpful, and then we can push it out to our constituents.
Yes, we'll certainly get that to you. Thank you very much.
Thank you. Commissioner Marecki, then Commissioner Barker, then Commissioner Kane.
Thank you, Madam Chair. I'm just wondering, Director Jordan, if you have a goal, a percentage goal of increasing the vaccinations and the boosters with all
And
this
this
money?
Yes, thank you. Very good question. So in terms of the age groups, we're actually trying to get at least an additional 25% of the individuals vaccinated, because again, we have a very small baseline currently with the numbers with our 5 to 12-year-olds are currently, as I said, it's at the lower rate. So we're trying to make sure that we can increase those rates. And with our 20 to 29-year-olds, we also are shooting for a 25% increase over what we currently have. And so we're making sure that we have evening hours as well as weekend hours, in addition to being as convenient as possible. And we're also going into the homeless shelters, in addition to where we have individuals that are in congregate settings. You may or may not know, we've had some outbreaks in our sites, at our JDF sites. And so again, we're making sure that we are testing our employees as well as our juveniles to make sure that we can keep them safe and offer vaccines there as well, in addition to expanding it once a week for testing in our jails, so that we can make sure that our deputies, sheriffs, and our inmates are also continuing to be free of COVID. As you know, we have a program that has kept over the last year and a half, well, actually 2 years now, that we have been between 1% to 3% in terms of our positivity rate. And so when you look at that across the country at other county jails, we have done a magnificent job in making sure that we can keep as many inmates as well as our employees safe because of vaccinations and or for testing, and making sure that people are able to wear a mask, a KN95 and or N95.
Thank you. So your goals are primarily with kids. Are there any goals with adults, or are they pretty much set?
It's across the board. It's not just our young people. We are looking at our elderly population as well. In addition, like I said, for those who live in congregate settings, in nursing homes, those that are in shelters, individual group homes, those who have disabilities. And so we are trying to be as broad as possible. As I mentioned earlier, there are hotels that are actually accommodating Afghanistan refugees. And so we're actually there also. So we have a pretty broad area in terms of trying to reach the population that is most vulnerable and are impacted.
Oh, okay. Yeah, no, I know you said that, but I was just wondering if you were targeting the general population as well. Or do you think they're pretty much set? They're either going to get the vaccination or they're not going to get a vaccination at this point? The general, I mean, I know you went through the list of the adult, the vulnerable places.
Yes, and it is then the campaign is a broad campaign that will reach over the 42 communities. However, we know that we need to pay special attention to be in these communities where each week, as you know, that you see the very high case counts, particularly in Dearborn, Livonia, Taylor, Westland. So trying to make sure that we definitely reach those areas and be there.
Okay,
to address
thank you.
Thank you, Director. Commissioner Varga?
Thank you. Does Lincoln Park still operate for vaccination? And if yes, for how long?
Yes, the Lincoln Park is still in operation. In addition to, it will be in place. We received some state funding for that. And so we will continue to operate that site until we are perhaps out of the pandemic.
Are we going to test there as well?
We are not doing the hybrid testing there, and that is why we're expanding these to these particular sites to do a hybrid model.
Okay, thank you.
That was one of the challenges. I just wanted to add for you. That was one of the challenges that many people said, well, we don't have enough places that are doing testing. We only had 3 previously. So therefore, we were trying to make sure that we could develop sites that you didn't have to go from one place to get tested and someplace else to get vaccinated. The goal was to make sure that we can make this as convenient as possible by doing a hybrid methodology, and that you can be tested in one part of the building if you brought a family member or or you were yourself coming to get tested, and or if you needed to be vaccinated, then again you could receive the vaccinations also in another part of that particular building and or space.
Thank you. We appreciate the site for vaccination.
And just one quick question, and that's for boosters as well. People can get their booster if they need to as well.
That's correct.
Okay, great.
So
Thank you.
Awareness will address boosters also.
Okay. Commissioner Colleen? You're fine? Okay. Any additional questions? I think you might have covered item number 3, because item 3 are the testing locations and the site for the testing. Commissioner Kniezek?
Thank you, Madam Chair. I was just wondering if I could hear the list again of the hybrid locations that are being proposed.
Sure. That's Dearborn Heights at the Berwyn Senior Citizen Center at 26155 Richardson Street in Dearborn Heights. Livonia Senior Center, 15218 Farmington Road in Livonia. And in Redford Township at the Redford Township Community Center, 12121 Hemingway. Taylor at the Wayne County Community College District in Downriver Campus, 2100 North Line Road. And in Westland at the Jefferson Barnes Community Vitality Center, 32150 Dorsey Street.
So this next comment is not directed at anybody in particular. Yeah, every week when we come to these commission meetings, we get hammered by folks who are frustrated with what's going on relative to the COVID-19 pandemic and how we're responding. I've been very proud of this commission for standing firm on doing what's right and supporting our public and promoting the health and wellness of others. We're partners in this effort. We want to be good partners in this effort. I shouldn't have to come to a commission meeting to learn that 3 of these 5 new sites are in my district. It doesn't allow me to be a good partner to others in pushing out that word to the folks that we collectively represent. So I'm very excited that Redford's going to have one of these facilities. I'm excited that Dearborn Heights is going to have one of these facilities. I'm excited that Livonia is going to have one of these facilities. Again, I wish the communication was better so that I could be a better partner and a better advocate. I do not like coming to full board meetings in hearing things that impact my district for the first time. And I would just kindly ask that we keep that in the back of our minds moving forward. Thank you, Madam Chair.
Thank you, Commissioner. And if we could have the sites in writing, that would be helpful too, so we can know where they are in writing. Okay, any additional questions? And this again will go for 2 and 3 and 1. Additional questions on 1, 2, 3. Okay, do we have a motion for all 3 of those? We do have a motion and support for all 3 of them?
Palomera and supported by Commissioner Hagan.
All right. Okay, roll call vote, please.
Commissioner Anderson. Commissioner Basham.
Yes.
Commissioner Clark-Coleman.
Yes.
Commissioner Daub.
Yes.
Commissioner Hattis.
Yes.
Commissioner Colleen.
Aye.
Commissioner Kinlock.
Yes.
Commissioner Kenizik.
Yes.
Commissioner Marecki.
Yes.
Commissioner Baker McCormick. Commissioner Scott. Commissioner Varga. Vice Chair Palomera.
Yes.
Chair Bell.
Yes.
Motion carries.
Thank you so much. Next item, please.
On testimonial resolutions and certificates of appreciation, there are 2 items listed.
Okay, is there a motion?
Move approval.
And move their support?
Support.
Moved and supported to recognize the 2 resolutions and certificates of appreciation. All in favor, say aye.
Aye.
Any opposed?
Carries.
All right, thank you so much. Next item, please.
On memoriams, there are 7 names listed.
Okay. Any additions to the names? I will let everyone know that Ms. Lucas, who was the wife of our first county executive, passed away, and I have a memoriam on my desk with all commissioners' names on it that will be taken to the services. So just want to keep the Lucas family in our prayers. Commissioner Clark-Coleman?
I was going to mention that same thing, that Evelyn Lucas, wife of our first Wayne County executive, had passed away. And that her services are being held, she's at Pie Funeral Home.
Yes.
On Plymouth for her services and family hour. And I think one is Wednesday and the other one's Thursday.
And I'll make sure to send that out to all commissioners as well, in case you'd like to pay your respects for the Lucas family. Saw another hand, Commissioner Hayes.
Madam Chair, I'd like to add to the list 2 names. The mayor of the city of Wayne, John Racy, his father-in-law died, and 1 day and a half after that, his father died. So his father-in-law's name, Donald James McCreary, and his father's name, John Allen Racy. So I like to add both, and my sincere sympathy go to both families.
Thank you, Commissioner, and please give them our sincerest condolences. Thank you. Still no names for memoriams. Commissioner Kinlock? Clark-Coleman?
I'm sorry, I forgot to mention that I would also like to add the name of Mary Jane Betts, B-E-T-T-S. She's the sister of Dr. Marge Betts. I served on the Detroit School Board with Dr. Betts, and she's a prominent physician in Detroit. She was at DMC most of the time, Sinai Grace. Her sister passed. So I'd like to add that name also, Mary Jane Betts, Betts.
Thank you, Commissioner. Any additional names or comments? Okay, if we could please have a moment of silence to recognize those that we've lost since our last meeting, please. Okay. Thank you. Thank you so much. Next item, Madam Clerk.
Public comments.
Okay, we have, I'll start with Zoom to see if there are any comments on Zoom. Everyone will be given 1 minute for their public comments. And we'll start, I see President Buffington. Good morning.
Good morning, and thank you for your time. I just wanted to tell you all, I appreciate you passing the memoriam on, or the resolution on the Fugitives Task Force. We had a member of the county clerk's office that was attacked recently in the downtown area. So even though there's a pandemic, there is still a situation of great danger out here. And I'd like to thank your staff for continuing to flow with these meetings with the changes in the times and the difficulties that you all are facing. Thank you.
Thank you so much, President Buffington, for zooming in today. I don't see any other hands. I'm looking at the screen. Madam Clerk, you may have to help me if you see any hands. I don't. Okay, now I see some. Caitlin?
Yes, good morning, everybody. I did have a question about the cost of the ad campaign. I was wondering if you all had any data regarding the previous ad campaign to show if there was any direct correlation between the $1 million spent for the ad campaign and a significant uptick in vaccinations.
Thank you, Caitlin. Public comments is not a back and forth situation, but if you contact your commissioner, they will assist you in getting that data that you requested. Christine?
Hi, can you hear me?
Yes.
Thank you. Your mask mandates primarily affect our children. With the exception of a medical office, I go everywhere without a mask, as do my children. When I look around in public settings, half of the people are without masks. Yet you force our youngest residents to wear them for 8 hours a day while attending school. I'd like to ask each of you, do you wear your mask for 8 hours straight, 5 days a week? Our children are the least affected by what the mask is trying to prevent, COVID, yet their mental health is most affected. You continue to brush off their mental health in the name of science. How do you sleep at night? If you believe you're protecting our older, more vulnerable community, please ask one of them if they feel safer using their grandchild's health as their shield. I'm not sure what grandparent would use their baby or anyone's baby as a shield for their own possible security. I say that because, again, as numerous studies continue to show, masks do very little. The state of Michigan showed in a December 14th study that school districts with masks versus districts without masks had similar case rates. Don't I get 2 minutes?
No, ma'am, it was 1 minute today.
Thank you.
Amen. Amen,
Thank you.
girl. I'm with you.
Robert, you're next.
Good afternoon, everyone. Robert Pulaski here, calling in from Southgate, Wayne County. Two things I'd like to address. The first thing, going back onto President Buffington's point on the Fugitive Task Force, I'd like to say thank you for passing that because, you know, there's a lot of crime going on in downtown, and just having that alongside, especially at Rosa Parks Transit Center, it does make a big difference for all illegal activity and also drug deals. So thank you for passing that, and keep Wayne County and Detroit safe. Second thing I'd like to tag on is the masks. This is ridiculous. We have to end this. I think the American people and the people of Wayne County deserve to have COVID completely gone, especially these testing sites. This has got to stop. Ridiculous. And all the money that you're putting into this, you're going to drain yourself into a hole with all this money you're throwing in here. And then you're also separating us as well, for students that are vaccinated and unvaccinated. That's a big separation tool, and it's going to make us.
Thank you, Robert. Billy?
Yes. Here we go again, approving more money for the health department, but yet no one seems to care about our children. Masks do not work. Western medicine does not work in my eyes. I am a herbalist and I practice holistic medicine. I believe in medical freedom and what God provides us and not what man-made is. Stop using COVID as an excuse for everything. It seemed like throughout this whole meeting, we keep using COVID as an excuse to this or that. Lift the mandates and maybe you guys will get some employees. Regarding the drinking water, regarding the drinking water, are you testing for parasites? 8 out of 10 people have parasites, which can cause autoimmune diseases. Out of the 8 people that have parasites, 7 of them will get the parasites from their drinking water. So will these funds being approved for drinking water be used towards testing for parasites?
Thank you. I don't see any other hands on Zoom. We have about 15 comments that the clerk will read into the record. Madam Clerk. I'm sorry, hold on, before you go, Madam Clerk, I do have one more hand. Tamara?
Hi there, thank you. I did want to call attention to a few different things. First and foremost, that New Jersey just announced that they're going to be lifting their mandates on masks in schools very soon. Highly encourage that you look into that. Secondly, I would like to question Commissioner Tim Colleen's recent Facebook post that poked fun at children who are suffering from being in masks and through all the different mandates happening. It was very offensive to many people, as well as very misogynistic in general, which quite frankly, I see a lot of mansplaining from him to several women in these meetings, including Health Department Director Melita Jordan. And lastly, I did want to call attention to the fact that there is a lawsuit that was just filed by Attorney David Coleman in Oakland County this morning against the Oakland County Health Department, and let you know that there may be one coming in Wayne County soon too. So thank you.
Thank you so much. Shannon?
Yes, I am from Wayne County and I just want to make a comment about all the mandates that are being imposed. New York is lifting their mandates and they are one of the hot spots. We need to get over this COVID and stop with this narrative. The masks are impeding our child's development. It's causing mental health issues. I've been on 2 mental health forums. I work with the community with the mental health of the children. Many problems of suicide is up, 51%, overdose is up. Many problems with anxiety. My worker we work with, we have 60 students for anxiety that we're working with, and it's getting where we just need to get over back to normalcy and stop this this narrative. And as I don't know if it's possible the health department is approving all of this data when there's been so many releases about what is happening with these vaccines.
Thank you so much. Now we have comments from the clerk's office, from our clerk. Madam Clerk, if you could read the comments that you have.
Good afternoon. My name is Trisha Hagan. I am the sister-in-law of William Hagan.
Madam Clerk, are you speaking into the microphone?
Good afternoon. My name is Trisha Hagan. I am the sister-in-law of William Hagan. What happened in my brother-in-law's case is awful and unacceptable. Both Detroit Police Department and Wayne County Morgue dropped the ball on this case. I'm going to start with Detroit Police Department failing this family. I find it sad that there are laws in place to protect police officers, but they don't have to follow the laws when it comes to their job. It states in Act 319 of 1968, law enforcement agencies directly enter information into name. Williams' case wasn't even entered into NamUs until 9/10/2019. His body was found 7/22/2019 with incorrect information. His autopsy states age range 23 to 57 years old. No inventory of remains, estimated time of death, or distinctive physical features entered on the report. All autopsy report. This is from Cali. As Heart Month and past resolutions discussing the importance of a healthy heart, but you continue to limit physical activities and gym classes in our schools. Schools are lowering their cardio activities because of your mask mandates. And sadly, they need to become the harm masks cause during strenuous activities. You say one thing is that mandated medical device, i.e. mask, that go against you. Please rethink your stand for mask mandates for our students and school staff from Cal. I'm Elaine Radley. Good morning. With all the studies coming out, and now this morning, New Jersey announcing it's dropping the mandates for public schools, cloth masks don't work. They are continuing to create more learning loss for kids already behind in the last 2 years. We are done with the kids being the target of all this political garbage. It's absolutely shameful that you are allowing this to continue. Do the right thing. Hello, my name is Renee Bergeron. My comment today is the same comment that I've had at every school board meeting, commissioner meeting, and the Board of Education meeting. The mandates in schools needs to stop. In the beginning, when less was known about the effects on kids, the mandates were not okay. 1 year into the supposed pandemic, the mandates were not okay. 2 years into this tyranny, and the effects are known. A 1% death rate and extremely rare cases of any illnesses are definitely not okay. It is not the responsibility of our healthy kids to make you feel safe just because you are fearful. Many of you have had nobody run against you for your commissioner position, and it shows. You are arrogant, base your opinions on what you're told to believe, and very comfortable in living your life into retirement as a follower rather than a leader. I pray this problem has risen up the fighters in all of us, and your terms are limited. Our children in this state are suffering enough. Please end mask mandates. Thank you. It's been going on long enough. From Matthew Taylor. So here's my public comment that I would like to read at the Board of Commissioners. Half of us, as it will be in attendance due to it being during the day, I will be at work. Honorable Board, my name is Matthew Taylor, and I have a question. Why have we not yet seen the rolling back of mask mandates for our children? We come meeting after meeting and time after time, and you still do not. As in the public record, that no educational institution can require masks for individuals under 18. Why are institutions that are still requiring masks still being funded? Choose today if you will do the will of the people or the will of the tyrannical authority that wishes for a cowed public. Respectfully, Matthew Taylor. President, I appreciate your desire to keep our community safe. With that goal in mind, I address you today. While you have stated you do not make policy, last fall, Governor Whitmer announced that she will introduce the biggest school aid budget in more than 20 years. for support of any further mandates to instead recommendations. New guidance from the CDC on masks suggests there is room for a compromise. Respirators and other high-quality masks are effective at protecting their wearers regardless of what people around them are doing. That makes my mask protects you and your mask protects me obsolete. Public health and school officials are asked to emphasize personal choice. It's time we stop worrying about from Dr. Leah Riley. Dear Board of Commissioners, you passed a resolution on December 2nd, 2021 within less than a week in response to the shootings at Oxford High School on November 30th. Across our county. One recent report is of a 17-year-old boy who suffered a traumatic and barely being able to get out of bed for 75% of the day. This is just one example. Have the authority to, at the very least, pass a resolution to stand against these illegal, tyrannical, and Joseph Pokerwinski. Dear Board, these mask mandates have to end now. We, the people, are fed up with your restrictions, our children's lungs and health. This new variant has become the common code. It is well past time for these restrictions to end. Children's immune systems are robust and created to handle viruses. It is unconstitutional and just plain sick. Stop treating our children like science experiments. You are paid by our tax dollars and we demand these restrictions stop. Not just the mask, but the testing and the vaccines. We are no longer in a pandemic. Joy Pokerwinski. This is from Stephanie Van Dane. I would like to draw your attention to the Dr. Fauci's vocal promotion of COVID vaccines for children as young as 5 years old. This is unconscionable considering that children have virtually no risk of serious disease or death from COVID. And he must surely be aware that from mid-December 2020 through January 21, 2022, there have been 1,071,856 injuries, including 22,607 deaths following COVID vaccinations as reported in the US government's vaccine adverse event reporting system. Asking parents to sacrifice their children's health for a disease that is mainly affecting older, unhealthy Americans with comorbid conditions is a failure of epic proportions. I quote Mr. Robert F. Kennedy Jr., "The push to vaccinate children has nothing to do with their health and everything to do with aiding billions of dollars to the bank accounts of ruthless, corrupt pharmaceutical companies. Our children's health is more important than paying the elite." Stephanie Van Dyne. This is from Cindy Simnowitz. Good morning, commissioners. I want to tell you a very sad story about a 37-year-old man. His name is Prakash. Suffered a catastrophic reaction to the Moderna COVID-19 booster. On the morning of January 15th, he began to be nauseated and then that quickly turned into heart failure. Paramedics tried their best to revive him and they could get his pulse after 20 to 25 minutes of compression. But during this time, he experienced brain hemorrhage. After that point, he was in a comatose state. He passed away on January 27th. His wife is expecting a baby this month. My heart is breaking for this family. This should not have happened. This was a direct result of the Moderna booster. This has to stop. From Sheila Hochberg. Dear Commissioners, I am attaching a picture from a recent NFL football playoff game. There are 80,000 plus people sitting elbow to elbow, yelling, hugging, and giving high fives. All the while, our children sit in school for 6, 7, 8 hours a day with a mask covering their nose and mouth. We the people are done playing nice. We have begged and pleaded with you and the rest of those that think they have the power to lord over us. The only power you have had is that which we have given you. Parents are fed up. We are taking our power back and are utilizing the full extent of the law. This is not only happening here in Michigan, but all over the country and the world. It is time for you to stop this nonsense before you and all those that were involved begin to experience the legal consequences of your actions. Whether you are directly or indirectly made decisions or were complacent that went against our constitutional rights, you will be held accountable. We know this is all about money. We know that our children have been sold into slavery and we will no longer allow this to happen. This is from Carla Chesney. To whom it may concern, please end the mask mandates. I pulled my child from the public school system. She has never been masked and she never will. Stop the mask mandate madness. Leave it up to the parents to choose what is best for their children.
Thank you, Madam Clerk. Next item.
Considerations.
Every considerations, there are none. Next item.
Remarks by members.
Okay, remarks by members. Are there any remarks by members? Commissioner Anderson.
Chair,
Thank you, Commissioner. You're absolutely correct. Commissioner, I think I saw Colleen, then Ambassador Mareki.
Thank you, Madam Chair. Clear across this land, dare I say, from sea to shining sea, the authority for public health is given to public health officers, not to members of Congress, not to members of a state legislature, not to your city council, and not to county commissions. And this commissioner is going to resist all the calls, as I have so far, to further politicize this discussion we've been having in this country by being urged to involve myself in something that I have no authority, nothing to do with. So we'll leave it at that, Madam Chair. It's just, it's misguided to go after elected officials who have nothing to do with this.
Thank you, Commissioner. We've said that over and over again.
One more time.
One more time, Commissioner Basham.
Thank you, Madam Chair. First of all, our regularly scheduled meeting for audit will be postponed. But also sitting in the audience, learning about politics, about public meetings and stuff. We have a new intern. Her name is Gracie Goodilly, sitting in the back.
Hi, Gracie. Nice to meet you. Welcome, welcome, welcome. Thank you, Commissioner. Commissioner Kinlock, or Marecki, or Marecki and Kinlock? Marecki and Kinlock. Okay, Kinlock and Marecki. Louder, please. Thank you. If you could make that in writing to Ms. Janelle Allen and Director Jordan. And then if you could also make mention, copy me and then make mention of that also to Commissioner Baker McCormick for her meeting tomorrow. So she can raise that question since the medical examiners will be there tomorrow. You're welcome. Commissioner Marecki.
Thank you, Madam Chair. As I start my comments, I'm sure I'm the only one in this room that's going to agree with my own comments. But I just wanted to make some as a citizen. Commissioner Colleen is right. The County Commission and Commissioner Bell, Chair Bell, has said this many times to all the parents that have been on our Zoom calls, that the way we're set up in this county, the commission has no jurisdiction over the health department. If we didn't have a CEO, that would be different, but we have a CEO. So that's how come we're set up this way. When this virus started, of course, nobody knew what was going on. Now we're going into our third year. If you look at the mask studies, they're all over the board. You can't pinpoint a consistent study because it's too hard to do a study on these type of things when the kids are out of school or they're on the weekend, they're going places and then they come back to school with a mask. But a couple of things happened the last few weeks that just have compelled me to say something. The governor came forward with her budget and wants to give $361 million to mental health in the schools. She's going to put in 40 school-based health clinics, expand mental health screening, hire 720 nurses, counselors, and social workers for the schools. Her quote is, "The last few years have been hard on kids with consistently changing circumstances and stress. They are resilient, but they need our support. There's going to be wellness check-ins, calming rooms, meditation rooms." And I agree, we're going through mental health problems. These kids, like someone mentioned somewhere, the suicide's up, drug use is up, et cetera. But we continue actions that limit social interaction in normal life with these kids. Someone in a letter, I think, mentioned something I was going to talk about the CDC now recommending for Omicron surgical masks or N95. Surgical masks are much easier to wear than N95s, as you all probably know. But these are very effective masks. Nurses wear them in the hospitals, doctors as well. So the whole concept of, oh my gosh, your mask protects me, isn't necessarily right anymore if people are wearing these type of masks. Some of these kids don't mind the masks. They wear them all the time. Other kids are having a very difficult time. And I see that not only from the people that come here, but I hear it in other walks of my life. So I'm encouraging the governor, who's the leader of this state, to maybe relook at some of this stuff. I know Wayne County did their own mask mandate, but I think there can be guidance from the governor's office. Last week, she came out and said schools should be getting back in person, and those schools are getting back in person. One other thing, we all received an email last week, and someone sent us the Michigan COVID response data and modeling update from Michigan Medicine. This is on mi.gov as well. And this goes up to December 14th. And this showing the trends in Michigan of COVID and surrounding states. One of the slides, this is quote, school age case rates have become more similar across mask rules as community transmissions have increased. U of M followed students all the way from August to the Christmas break. At the beginning, it appeared that masked students were lower in their illness than unmasked. By the very end of November, the masked kids were higher with COVID cases than the unmasked kids. They were higher than anyone. So this is all stuff I think that people should be looking at, and it does sound right. A mask will protect you across the board, but it's not necessarily that. And again, these studies are all over the board. So I just wanted to voice that, and I appreciate your listening. Thanks.
Thank you, Commissioner. Any additional remarks by members? Oh, that's okay. Okay, any additional remarks by members? Joey? Okay, no more remarks by members. Like I had some, oh, no, one remark. This is Monday, obviously. We're scheduled to meet last Thursday, but we were having like a 30 million inch storm that didn't quite happen, but we listened to the weather forecast and moved the meeting to today. I just want to thank our Public Works Area Director Watts and all of the men and women who went out and plowed and salted to get our roads safe for all of us to travel on. They did an outstanding job, although we are still short drivers, but they did an outstanding job with the workforce that they had. So I just want to give that shout out to DPS, all the men and women, and Director Watts for really handling the snowstorm. And thank all of you for being understanding and postponing the meeting and having the meeting today. Without further ado, hearing no other remarks by members, I entertain a motion to adjourn.
We'll adjourn.
All right, thank you. We're adjourned.